everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, and here from the JWC studio this week, we're going to get a little bit under your skin. Today, I've got Dr. Vaidya. He's the senior dermatologist here at Jahangir Hospital and here in Pune. Thank you so much for being here, Dr. Vaidya. It's been a long time. I've been hoping to have you on so we can talk about all things skin and dermatology. So thank you for being here.
Thank you for inviting me. Hope to have a good discussion with you.
Absolutely. I mean, it's one topic that I know that lots of people have opinions and thoughts about. First of all, how did you get into this field?
That's a good question to start with. I entered dermatology almost 20 years back.
Okay.
And why I entered dermatology? There were 2-3 reasons. First of all, dermatology is not only about medicine or only about surgery. It's a blend of medicine, surgery, as well as aesthetics. So that was one of the most interesting and challenging things. Now, medicine is only about medicine. Surgery is only about surgery. But dermatology is the mix of that.
Everything.
And top of that, we are treating the largest organ. Skin, as you know, it's the largest organ.
Yeah.
And the other part is it's a visible thing. Now, if you're treating diabetes, something is going inside. Yes, that is also important. But if somebody is scratching, if somebody is having pimples, if somebody is having hair fall, it is obviously seen. And treating those people is always going to be a, what we say as interesting. And we are going to change their lives. So that was very interesting. And that's how I entered in dermatology.
Okay.
And what kept me therein for last so many years. Now, you will feel that treating these conditions is going to be a monotony, but it's not like that.
Okay.
Because dermatology is a ever-evolving field. Now, when I entered in dermatology, there were very few resources for us for treating the skin conditions. But now, there are so many new things which are evolved in dermatology. To name a few, like lasers, a lot of lasers have come into the market. For laser hair removal, for skin rejuvenation, for acne scars, for hairs. There are so many lasers which have come, and the technology is developing day in, day out.
Yeah, absolutely.
So that is also very interesting. And not only in aesthetic field, but also in dermatology per se, there are a lot of new injections, new molecules which are coming up. Like initially we used to think psoriasis is not a treatable condition. Now because of this all new biologics, we can at least offer good relief to the patients who are in real need. So lot of new things to learn, lot of interesting things are happening in dermatology, and that is how it is giving me good, yes, for last 20 years now.
Lovely. I mean, there's so many aspects that I want to touch upon from what you said.
Yes.
Perhaps the first place that I thought of when you said the word aesthetics, I'm sure a lot of people think when they think about skin, they think fairness.
Fairness.
So what are your thoughts on that today? With particularly, fairness versus, as you were talking about, skin health.
Skin health.
So
yes.
How do you balance the two? What are your thoughts on that generally?
Now, see, people come to dermatologists and they ask, I want to change my skin color. I want to become more fairer. See, unfortunately, we are still in the mentality of fairness. People don't understand that your own skin is your own skin, your own color is your own color. So what I generally tell them, your color is your color and you need to make it more healthy.
Be comfortable in your
Be comfortable in your own skin. So that is very much important, because fairness is associated with many bad things also. And for fairness, people go to any extent. Unfortunately, before marriages, now most of the times the bride or the groom, they feel that they should look good. Looking good is different and fairness is different. Unfortunately, the concept of good looking is fairness.
Right.
Now, I tell them examples like there are so many new good models which don't have fairness, but they are having good healthy skin. And we should look at good healthy skin.
What is
that? Is very much important.
What is healthy
good healthy skin is the tone should be even. The scarring, blemishes should be minimal.
Okay.
And it should be a glowing skin.
Okay.
Now, but to achieve fairness, what people do is people go to any quacks or not qualified dermatologists.
Right.
And unfortunately, in India, that problem is still persisting.
It's a big
For
problem.
the sake of doing something, people do. And people use a lot of steroids. I'll give you an example. Yesterday only, one patient came to me. She had a severe bad face, lot of pimples. The skin was thinned out, lot of hair growth was there. I said, what happened? She said, I went to my parlor. She gave me a cream. The name of the cream was Gori cream.
Gori.
So you can understand.
It's called Gori cream.
Gori cream. I can show you a photo. It is called as a Gori cream. And she had got that product. So I just looked at the product. Nothing was written on that, what it contains inside.
Wow, that's so scary.
Yeah, mostly some steroid or some what we say as heavy metals or something must be there in that. So details were not written. So what it does, it gives an instant glow, which is not good. Because of the steroids, there is a temporary glow. Once the patient stopped using that, all this side effect came.
Oh God.
And unfortunately, her marriage was in next 2 months.
Right.
So it is going to be a hard time for me to treat her.
Not
So
enough.
that is how the problem is there. People just walk in some parlors. The parlor people give some kind of creams which they are not supposed to give. Parlor is meant for cleansing or taking skin care, but not applying some products. So while taking any products, you should be assured that it is given by a dermatologist,
Yeah.
a well qualified dermatologist.
Right.
So that is very much important. And I always tell them, don't run behind fairness. Be behind a healthy skin, which is a glowing skin, which has got a even tone,
Right.
and less of blemishes.
And what can we do to have healthy skin? Like, what are the habits
So
that
healthy
should we...
skin is what I always tell them. It is not done in the clinics as well as in the medical stores. It is about your lifestyle.
Yeah.
See, yes, I'm there to guide them how to take care of the skin. But what is your routine? How is your lifestyle? How many hours you are sleeping? What about your hydration, your diet, your exercise, stress factors? See, this all matters to have a good, healthy skin. Yes, there is a skin routine, something which we'll be discussing afterwards. But overall, your lifestyle is very important. And unless and until you improve your lifestyle, it is not going to be reflected on your skin. I always tell them ki whatever is going inside, your skin is a mirror of that.
Yeah.
So whatever is going inside is reflected. So if you are happy, if you are healthy, it is going to reflect on your skin.
Right. So, what are the most common things that people come to you with then, for in terms of skin ailments or skin?
Skin ailments, now there are two aspects of this. One is the clinical dermatology, where people are suffering from itching,
Right.
some skin infections, then pimples, and there is some aesthetic part, like
Yeah.
for hair fall,
Yeah.
like they want a even skin, they want a glow on the skin. So I always feel dermatology is a mix of all this.
Yeah.
It is only not about doing procedures, or only it is not giving medicines and creams.
Aesthetic.
So it's a combination.
Right.
So many people feel that there is a difference between an aesthetician or a cosmetologist. There is nothing like that. There is no degree as cosmetology.
Right.
In the dermatology, one part is aesthetics and cosmetology. So if any person comes to me, say now we'll take an example of a patient is coming for acne or pimples.
Right.
What first we need to understand is we need to evaluate the skin. How much oiliness is there? What grade of acne is there? How his lifestyle is there? What he is consuming daily? Then is he doing exercise? Is he consuming proper water or not? That we need to evaluate. We need to start with the medical line of treatment and then venture into chemical peels or lasers or something like that.
Right.
So we need to have a combination of medical treatment and aesthetic treatment.
Okay.
And your dermatologist is trained for this.
Right. Absolutely.
So you should find a dermatologist who is trained and then only consult him. You should not just see the big boards naming them as cosmetologist or something. There is no degree of cosmetologist.
Okay.
You should go to a qualified dermatologist.
Fantastic. So, since you're sitting in front of me, Doc, then maybe I'll ask you a personal consulting question. Because as it so happens, fate, where doing this episode today, I've also developed a pimple over here.
Yes.
Which, if someone zooms in, perhaps they can see that. Let me ask you.
Yes.
People have many opinions about how they should deal with it. Should I be bursting this pimple? Should I not burst this pimple? What are the right
So there are a lot of
things to do?
myths which are there across, means especially this social media.
Yeah.
And I will like to state this social media has made skin care more louder rather than wiser. So people are banging, use this, use that, don't do this, don't do this.
Yeah,
So
so
that
much
kind of
noise.
thing, so much of noise has been created, but it has not become wiser. There are so many myths which are associated with skin. Now, one myth you asked me whether to pop it or not to pop it. Strictly, no popping out
No
of the
popping.
pimples.
Okay.
Because if you pop out, it is going to leave a mark and a scar, and it is very difficult to treat that.
Okay.
So applying a simple cream is going to help you out. I think it must be because of your stressful lifestyle
Oh,
or something like
hopefully
that.
not so much.
So that might have popped out. So
Yeah.
popping out of pimples is a
Big
strictly
no-no.
no.
Okay. What are the other big myths that you get frustrated when people come to you with? Not necessarily with pimples, but anything.
See, now the market is loaded with so many of serums.
Right.
Now people come to me and they keep multiple bottles in front of me. I ask them, what is this? They say, Kim, this is a niacinamide, this is vitamin C, this is retinol,
Right.
this is hyaluronic acid. I ask them, "Ki, Arey, what you are doing? Means so many creams, so many serums to apply. No, this is my skincare routine. Mornings I use vitamin C. On top of that, I use a moisturizer. On top of that, I use a sunscreen.
Yeah.
Night I'm alternate nights I'm using so overloading your skin is going to cause problems.
Right. Of course.
Now, identifying your skin is also important. Now, if your skin is dry and if you're using retinols, it is going to cause you problems. So, you need to understand whether your skin is oily, whether it is normal skin, whether it is a dry skin. And depending on that, you need to select the products.
Okay.
And what I always tell them, it should not be a complex thing. It should be a simple, sustainable routine skincare which you should follow.
So, for example, I was going to ask you, you talked about skincare routine. What is the skincare routine that you follow for yourself?
So the thing is, it's very simple. For females, I slightly tell different. For males, I slightly tell different. For males, it is simple because they don't like to use too many products.
Right.
So after assessing the skin, the most important thing what I feel is using a sunscreen is very important. Hydrating the skin is very
You're
important.
saying regardless of whether you're going to be in the sun or not?
Yes. Now that is again a second myth. So if you are in a rainy season, people don't use sunscreens.
Right.
They say why it is not required because there is no sun around.
Yeah.
But it is not true. The ultraviolet passes through the clouds also.
Right.
So you need to use a sunscreen. Now, if you're going to sit in front of the computers for a long time, they are also emitting blue light. They're also emitting the ultraviolet light. So you need to use a sunscreen routinely.
Wow, you're saying I have to use sunscreen if I'm sitting in front of a computer.
So what I feel is if you're not using any other serums, use a sunscreen. Because sunscreen is going to help you in reducing your skin aging, your blemishes. So sunscreen is the basics of any skincare routine.
How interesting. I didn't realize that you can use it for pretty much everything.
Yes, for indoor activities also you should use a sunscreen.
Yeah, that's fascinating if you say I need to be using
So
sunscreen
you have to use a sunscreen.
for a computer.
Yes. So sunscreen, then second is hydration.
Right.
So skin hydration is also important because otherwise if the skin is too dry, the barrier is not maintained and then it causes a lot of problems. So using a sunscreen, so the last layer should be a sunscreen. So start with cleansing your face. The cleanser should be a mild. It should not be too irritant. Then sometimes I ask them to use a serum if at all it is required depending on the skin condition. Then afterwards a good moisturizer and on top of that a sunscreen. So these three steps are must and that is going to be sufficient in the morning.
Okay.
Nighttime you come home, you wash your face again with a gentle skin cleanser, or if it is getting too oily, you can use slightly a AHA, BHA, that is alpha hydroxy or beta hydroxy acid face washes. And then depending on the condition, either you use a vitamin C serum or a retinol serum or a simple bland moisturizer. And that's it. Your skin care should be there. Not too complicated.
Yeah, it sounds pretty.
So it is not like today I'm using hyaluronic, tomorrow I'm using vitamin C, now I will change it to retinol. So that is a big problem nowadays. So make it simple, which should be sustainable.
Right.
And if you follow that, there will not be a problem. But along with this, your lifestyle.
Of course.
I always insist on the lifestyle. That is very much important.
Hydration, sleep, nutrition, all those things. But coming back to the sunscreen aspect, when you talk about the sun and so forth, I'm just thinking about the other big thing that people are always talking about is that I don't have enough vitamin D, and then be exposed to sun.
Yes.
How does that play with skin?
Yes. Now, vitamin D, unfortunately, is deficient in majority of our Indian skins.
Exactly.
Now, see, I'm an athlete. I go for cycling.
You look like it.
But I go for long distance cyclings also. But unfortunately, my vitamin D is still low. I go out in the sun a lot. But still, because my absorption is less. So you need to take vitamin D supplement though you are going out in the sun.
Right.
And that is also very important. You need to identify whether my minerals, where my vitamins are less. Just supplementing is not going to be sufficient.
So that's why checkups.
Yes, checkups are very important.
Right.
Because sometimes if it is hypervitaminosis, what I mean by hypervitaminosis, when the levels are higher than expected, then it can cause problems. Especially if you are taking vitamin A, if you are taking vitamin D, E, and K, because these are fat soluble. It stays in the body.
Right.
Vitamin B and C are
water
water
soluble,
soluble, so that is not a problem. So, coming to your question, what about vitamin D deficiency? In spite of you are using a vitamin, means a sunscreen or not, there it is going to cause a deficiency.
Yeah. So again, you're coming back to the
Yes, and again, vitamin D is available not in the early morning suns, but it is in the afternoon sun.
Okay.
So it has to be a direct sun. So that is very important.
Right. But then again, coming back to the sunscreen aspect, and if you're talking about being in the sun, and you said, oh, fine, you may not be able to absorb it by just being in the sun. Does putting sunscreen actually stop more absorption in the sun, or how does
No,
that
no, no.
work?
The vitamin D3 production is going to happen. Going to happen. Now, to again, there are few sunscreen which has got vitamin D3 in that.
Oh,
So that is a marketing gimmick. So
Okay.
then it is not going to happen like
Right,
that.
right.
So use a sunscreen, and along with that, see, the thing is ki from other body sources also it is getting absorbed.
Okay.
So vitamin D3, in spite of using sunscreen, is going to be means it is going to, the production is going to be there.
Okay. So moving to another aspect of dermatology, we've been talking about skin and so forth. The other big one, particularly for me, who's I've potentially got the genes for it, is hair loss. So what are the big things that we should know about there, hair transplants, and biggest things that you think people should be aware of there?
Now, dermatology has got a lot of subspecialties, and one of the most important subspecialties, trichology. Now, what I mean by trichology is the hair care.
Okay.
So, dermatologists are officially trained for hair care. There are no separate trichologists. Now, you see many people calling themselves as trichologists.
specialists or whatever.
Yes, or no, and the hair special. No, dermatologists are trained for hair care. Now, hair care is one of the biggest industry right now.
Absolutely.
Now, people are very conscious about that. People want hair. People want black hairs till the age of 50, 60. And people are willing to spend a lot on their hair care.
Yeah.
Now, hair care is complex. It's not so easy. So, again, getting examined by a qualified dermatologist. I'm always saying qualified because nowadays we are having a lot of issue regarding the quackery. There are many non-qualified
Especially in
people.
your field. It's
Yes.
still more difficult to have quackery in something like cancer.
Cancer or in like ophthalmology or something like that. But in dermatology, people feel it's easy. Okay, just do a peel, just do something.
Yeah.
So that's why
So important that people know that.
Yes. So coming to hair care now, hair is a big problem. And initially we used to see a hair loss in late 40s or something like that. But now we are seeing hair fall in people of 20 years old also. And that is called as a male pattern baldness,
Yeah.
where genetics play a major role. But along with that, the lifestyle, the stress, the diet which you are having, that is also causing a lot of problems.
Yeah.
That is one type of hair fall which we are seeing. And other is something called as a telogen effluvium. What I mean by that, when a patient comes post surgery or post dieting or post any illness, so people is suffering from excessive hair fall. Now, that excessive hair fall is slightly different from the male pattern baldness.
Okay.
That may be because of the nutrition or something like that.
right.
So that's why I said we need to assess what kind of a hair fall that individual is suffering, and depending on that, we need to give the treatments.
Right. Okay.
So nowadays we are seeing a lot of things on the internet, other on the social media. Onion oils, onion shampoos, rosemary oils, and all these kind of things. So people are using a lot of products and they are damaging their hairs. So we need to consult and we need to take proper treatment of that.
What about the biggest myths in the hair space?
So the thing is, the hair space, a lot of myths are there. As I first said, onion is going to cause good hair growth.
Yeah.
Then other major myth is, once we do a hair transplant, I'm going to have hairs throughout my life.
Yeah.
But we need to take treatment post hair transplant also. So that is also important.
Right.
And not one formula is going to fit everyone. It depending on the genes, it depending on the individual. So what kind of a treatment to be done is that is also very much important.
Okay.
So
I mean, there's so many places that we can keep talking about.
yeah.
So what are the biggest takeaways that you would like to give people in terms of both on the skin side and on the hair? I guess it's sort of all related. As you said, it's this one
Yeah.
one big thing. What are the biggest takeaways that you'd like to leave us with in terms of what we've spoken about today, or anything that we actually haven't covered yet? You think something that you think needs to be
See,
addressed?
now the biggest takeaway what I will like to give through this channel is first, love your skin.
Yeah,
That is very much important.
I love that. Be comfortable in your own skin.
Yes, be comfortable. I will give you an example. Now, last week, one lady came to me and she said, I want a Korean skin, Korean glass skin. Now, that is the latest trend.
What does that mean?
So now there are a lot of Korean web series which are going on. And
Okay.
see, in Southeast Asia, their skin is quite glowing.
Okay.
They're all fair.
Yeah.
And that is because of their genes, that is because of their diet and many other things. So a lot of influencers are talking about Korean glass skin.
Okay.
So she came to me and she said, Doc, I want my skin like a Korean skin.
Okay.
I told her कि next generation, next time when you are again in this world, try to be in the Korean, try to have Korean parents. So you are not a Korean, you are not going to get a Korean skin. You are Indian and you should be proud of your Indian skin.
Right.
So genes is very important. Genetic part is very important in skin. So you cannot just mimic. Now people come to me, I want to look like Aishwarya Rai. I want to look like say Kareena Kapoor. I want to look like the eyebrows, the lips, especially the lip fillers. I want to
that's
look
another
that.
place I
So I'm not touching on that right now. But I want to look like that. So I always tell them is ki love your skin, look good what in you are. Try to improve the health of your skin.
Right.
So that is very much important. Don't try to mimic somebody else's skin because that is not possible.
Yeah.
And people are going to unnecessarily do something which is not going to be good for your skin.
Absolutely.
So, love your skin. Go to a qualified dermatologist. I'm again repeating
Absolutely, yeah.
because you should not fall in a trap of a quack because it is going to damage your skin.
And as you said, it's the most visual thing.
Yes, it's the most visual things.
Right.
So that is very much important. Try to have a skincare which is basic, which is non-complex, and which is sustainable. Regarding diet also, we always talk. The diet should be a sustainable diet.
Yeah.
Similarly, a skincare should always be a sustainable thing. It should not be a complex thing. And I always tell them this treatment is not going to be like 1 week or 2 weeks. It's like a journey. And try to find out improvements, small improvements. You're not going to see a drastic improvement immediately. For example, if patient of a pigmentation comes to me, after 15 days, he or she is not going to see the difference immediately.
Right.
So try to identify what are the positives, how improvement it is going to be there. And depending on that, we can always build up the further treatment.
Okay.
So love your skin, find a qualified dermatologist, identify your skin, try to have a very basic, non-complex skin sustainable kind of a thing. And along with this, you should have a good lifestyle to have a good, healthy skin.
Lovely. That's a lovely place to end and leave us in. I think I love that. Just be comfortable and love yourself in your own skin. Thank you so much for being here, Doc. It's been an absolute pleasure. As I said, I think there's so many aspects that we can keep talking about. So I think we will have you back very, very soon to talking about all these other aspects. So thank you so much for being here.
Thank
you.
Yeah.
Thank you all. And before you leave, do not forget to hit the like and subscribe button here at the bottom. Do remember to leave any comments you may have, any feedback on shows or topics that you'd like us to cover. We'd be happy to take that forward and see you all next week. Thank you.